In this update, we're going to be discussing an exciting trial that was published in Gastroenterology in 2019. This was a publication that came out of Denmark and was a head-to-head trial comparing fecal microbiota transplantation via colonoscopy or nasojejunal tube versus a 10-day treatment course of Fidaxomicin versus a 10-day treatment course of Vancomycin in individuals that had a median of 3 or 4 episodes of C. difficile within the past. Approximately 120 individuals were assessed for inclusion in this trial, and 64 were overall included. 24 received the fecal microbiota transplantation, 24 received Fidaxomicin for 10 days, and 16 received Vancomycin for 10 days. They were then followed for approximately 8 weeks. If any individual within any arm failed, they then received a fecal microbiota transplantation. The patients were assessed in 3 separate ways. 1, with clinical resolution of symptoms. 2, with confirmation of eradication via a stool assay. And finally, 3, the combination of clinical resolution and confirmation of eradication with a stool assay. And let's focus initially on the middle bar graph, which I believe to be the most important bar graph that we see on this screen. And that is that of clinical resolution of symptoms. And we see within this trial an efficacy of 92% for fecal microbiota transplantation versus 42% for Fidaxomicin and 19% for the Vancomycin. The other area that we're going to look at is the combined endpoint, including stool confirmation of eradication as well as clinical resolution. And within this section, fecal microbiota transplantation also performed very well compared with the other 2 groups, with an efficacy of 71% versus 33% for Fidaxomicin and 19% for the Vancomycin. So overall, this study reconfirms that individuals that have a median of 3 to 4 episodes of C. difficile, fecal microbiota transplantation is very, very effective. However, there are a few areas and points to think about when we contextualize this study. The first is that within this study, the treatment groups all had a median of about 3 to 4 episodes of C. difficile. With that being said, a standard 10-day treatment course is known to be ineffective for these individuals. Specifically, when we consider a product like Fidaxomicin, Fidaxomicin's benefit is that it has a narrow spectrum. By having a narrow spectrum, it allows the colonization resistance that's present to regrow. By the 3rd or 4th episode of C. difficile, the colonization resistance is most likely sufficiently depleted that it is unable to grow back on its own in an appreciable manner. The standard of care at this time for patients that have multiple episodes of C. difficile, according to the IDSA guidelines, would be a prolonged vancomycin taper with either a rifaximin chaser, or you could consider Fidaxomicin. However, we see within this trial that even Fidaxomicin as a 10-day treatment course might not be effective for this group. The data that supports Fidaxomicin most strongly is for those with an initial infection, and also the subgroup analysis from the 2 main phase 3 clinical trials showed a good efficacy of Fidaxomicin versus Vancomycin for those with an initial recurrence. In addition, within this trial, they used an endpoint of a stool assay to confirm eradication in 2 of the primary endpoints. One being the stool assay alone, and the second being clinical resolution with the stool assay. As discussed in other sections, a stool assay can be false positive frequently in patients that are clinically cured. In clinical practice, it's most important that we assess the patients as individuals and their clinical symptoms, and we hold back from using the stool assay. So for me, the most important data point that we see within this study is the middle data point that shows the clinical resolution in a significant percent of the patients receiving fecal microbiota transplantation, 92% versus 42% in Fidaxomicin, as well as 19% in those that receive vancomycin. So this is certainly a thought-provoking study and one that reproves that fecal transplant is effective versus 10-day treatment courses of fidaxomicin and vancomycin.